Hi all, in my last video I have explained the IV therapy and the types of solutions. So today I'll be discussing the continuation of IV complications. And the complications we can see towards the patient is one is hair embolism, infiltration, infection, circulatory overload, phlebitis and hematoma. Hair embolism. Usually the hair embolism happens when the hair is enter into the vein through the IV tubings. The symptoms usually seen in tachycardia, chest pain, hypotension, level of consciousness will be decreased and cyanosis. The treatment will be clamp the tubing immediately and turn the patients towards the left side and place in Trendelenburg position and notify to the healthcare practitioner. In infiltration, the IV fluids will be leak towards the surrounding tissues. So what is the symptoms we can see in this infiltration? One is pain will be there and swelling, coolness and numbness will be there. The treatment is remove the hymen immediately and elevate the extremities, apply a warm or cold compress and do not rub the area. The most common complications seen towards the patient is hematoma. So the collection of blood will be into the tissues and the symptoms will be ecchymosis at the site and blood and hard and painful lump will be there, and the treatment is elevate the extremities and apply the pressurize. What is phlebitis? The phlebitis will be inflammation of the vein that can lead to the thrombophlebitis, and the symptoms will be pain will be there at the site and heat will be there, warm and redness, tenderness, and the IV solution flow will be decreased. The treatment will be remove the IV line and inform to the healthcare practitioner and to restart the IV line on the opposite side. Next is infection. In the infection is entry of microorganism into the body via through the fluid volume. The symptoms will be tachycardia, redness, swelling, chills and fever. And the treatment is remove the IV line and obtain a blood cultures and administer the antibiotics. Next is circulatory overload. Why the circulatory overload is happening is administering the fluids too rapidly. That means the fluid volume will be overload, and the symptoms will be blood pressure will be increased and distended neck veins and dyspnea, wet cough and crackles. The treatment will be we need to decrease the flow rate and elevate the head of the bed and keep always client warm. I hope in this video you can clearly understand what are all the complications you might see towards the IV line and the treatment and the symptoms. So do watch for more videos. Thank you. Bye bye.